All right, how to use Kinesio Tape to improve core stability. I'm Dr. Michael Lee, certified Kinesio Taping instructor and one of the instructors here in the UK. So thank you so much for joining me today. How many of you as clinicians struggle to get a patient's core stability to work? Right? How many of you sometimes throw so many exercises and then you're feeling for transabs, feeling for rectus abdominis, but the patient still struggles to do some core work or even activate? Yeah, great. Because this is where kinesio taping can actually help. Because if you're one of those clinicians that you've been giving exercises to patients, but they're still not getting any hypertrophy, it's still wasting away, they can't activate well enough. And this doesn't just apply to core stability, by the way. This applies to all muscles in your body. Then what's actually happening here isn't a structural problem, because there's this common myth in the musculoskeletal world that, if you do an exercise, it will eventually work. Yeah, there's some truth to it. That's called post-activation potentiation. That can work, but you have to put so much load through it, they get neurological leakage to get other muscles actually working as a compensation. But the thing is that when you're giving specific exercises, whether it's a core, whether it's a plank, whether it's a transab exercise, whether it is an oblique exercise, whether it's a rectus abdominis exercise, and you're feeling for the contraction for those muscles. And of course, there's an argument that actually, can you even feel to the right level to actually feel if that muscle is working? Yeah, to some degree. I would, from my opinion, I'd say osteopaths have the best hands in this industry, and they can feel at different depths. But if you may be a different type of clinician and you've been practicing and you've got experience in that, you maybe feel it too. But many cannot. But the thing is that what I want to talk about today is for those that are struggling to get a patient, an athlete, and they're struggling to get their muscles working. And they've been working on it week in, week out. And then the patient always says to you, I've been working really hard, really hard trying to get this muscle working. And I've done your exercise that you've given me religiously every single day. How many times? So many times a day. But I'm months down the line and it's still the same. I still find it just as difficult. I still find it really challenging. And the question is why? Because the thing is that it's not a musculoskeletal issue, and this is where a lot of MSK clinicians they miss the most important part, and it's the neurological component. Because let's be honest here, whenever you test, you might have seen nerve conduction tests. Whenever and obviously not every patient gets it, but if you get to look at it in research, if there's no nerve going, no signal going to the muscle won't work. And a lot of the myth that a lot of clinicians believe is every single muscle can be contracted consciously. Well, I mean, you can think about contracting it, but does it actually work? Just think about all the stroke victims. They're thinking about contracting the muscles. They're wanting the muscles to contract, but what happens? It doesn't. So what's actually happening here? There's actually a protective mechanism that's actually overriding that conscious decision. And some people, you can even see it as something called a palsy. You may see Bell's palsy when there's drooping. You may see a palsy in other parts of the body where the nerve isn't firing to that muscle, so the muscle will not fire. So how can actually kinesio tape improve these muscles and muscle activation, but most importantly, core stability? The reason why I focus on core stability today is because there are a lot of theories out there that yes, all the muscles around the middle, which we call zone 1, when they work, other muscles around don't need to compensate and then get the core muscles working. This is why core stability. A lot of people don't believe in core stability, but let's be real here. Without stability, you have nothing. And there's that famous saying, it's a bit like firing a cannon out of a canoe. What happens to the canoe? It just capsizes. But you need to fire a cannon out of a gunship. It needs to be stable enough to withstand the force. And the gunship is the core muscles. But a lot of people struggle with getting their core muscles working because the nerves doesn't even work. So what can we do with kinesio tape? Well, the first thing we need to do is we need to stimulate those nerves. And quite simply, there are two simple, and we call them the fundamental applications in kinesio taping. The first one is muscular facilitation. And what is muscular facilitation? If we know that a muscle is hypotonic, so it doesn't have the ability to contract, we can facilitate it to get it contract by stimulating the mechanoreceptors. Those mechanoreceptors only can be stimulated by a specific tactile stimulus from the tape. So it's a specific direction, a specific compression, or a specific pressure on it, and then that will determine how to get this muscle working. So for example, for rectus abdominis, for example, a lot of people have this thought that, oh yeah, to get the rectus abdominis, you need to do sit-ups. Now, let's think about human movement here and human function. How often do we actually do that movement on a day-to-day basis? Probably once to get out of bed. But how about in a day-to-day basis? Do we do any more than that? Probably not. So why are people focusing on doing these crunches, these sit-ups, right? Because actually the main function of the rectus abdominis is to hold the pelvis up so that the hips can pass through. And this is why it's so important to make sure the lower rectus abdominis is working to help runners, cyclists, swimmers, cross-trainers in the upright position, because so they can allow a minimal amount of impingement in the hip joints. So if we can get the rectus abdominis working, we need to then tape the rectus abdominis in the right direction, because the question here is, where is the insertion, where is the origin of the abdominis? A lot of people think, oh, the origin is the xiphoid, because that's the thing that that's where it all begins, and then the insertion is the symphysis pubis. But the question is that the origin is usually the one that is fixed, and the insertion is the one that moves, right? So this is the thing that, yes, if the origin is truly the xiphoid and the insertion is the symphysis pubis, that's right. That's why leg raisers is true. That would activate the abs to work normally. But if we're switching around and making the symphysis pubis the origin and the insertion is then the xiphoid and doing the crunches, that's actually the wrong way around. Yes, the origin is the xiphoid. That's how the abdominis actually works to stabilize the pelvis. So in terms of how do we then tape it, yeah, we should be taping from the origin to the insertion, and it recoils back to allow the abdominis muscles to work. But the thing is, I hear you, but Michael, what if they're so deconditioned that they still find it difficult? That's okay. That's why I spoke about the second fundamental type of taping that we use. It's something called functional correction. And functional correction specifically works with the fascia. We can apply the tape on the xiphoid or either side of the xiphoid and put high tension and put the soft tissue or put the rectus abdominis in a shortened position and then tape it while lengthening, and then it acts like a spring. And now the rectus abdominis is going to function how it's normally going to function without the muscular contraction. So I always only use the functional correction if someone is at the very, very, very beginning stages of getting their core muscles working again, or getting any muscle working again, because sometimes they haven't been able to activate those muscles for years, months, or even decades anyway. So I really hope that you're finding this really interesting but helpful, because a lot of clinicians always forget the neurological component. How do we activate the right mechanoreceptors to get the nerves working, then to get the muscles activated so that we can truly help patients? But a lot of clinicians, they keep banging away at exercises and doing the same thing, only getting exactly the same result, which is actually the patient struggling, being frustrated, and they're not actually improving in the long term. So if you've got any questions, I really hope you find this helpful. And if you've got any questions, put them into the chat. And I'm Dr. Michael Lee, and I'll be teaching the next live fundamental training in Sheffield later this year. So if you're interested in learning this concept, from Dr. Kenzo Cassie, the inventor of kinesio taping, understanding how kinesio tape can make life-changing differences to people's movement, to people's pains, to even to people's diseases too, then just comment me in the chat and one of our advisors will come and reach back out to you, because it's our mission to help as many people as possible so that they can live healthier and happier lives. So thank you so much for joining me today on Monday. I really hope that you learned a lot today. And if you'd like to learn more, particularly the practical elements of how to apply Kinesio Tape perfectly and consistently getting the results that you want, please let me know, because this is the reason why we love instructing and we love teaching. So again, thank you for being here today, and look forward to seeing you next Monday. Have a great week. Bye for now.